Good morning, everybody. Good morning once again. Yeah, it's a pleasure to be invited to this forum so that we can together discuss and digest about the People's Health Manifesto. Before I take over and give my opening remarks, I would like kindly for all community health workers in the house, not only wave, kindly stand up. Afya yetu, afya yetu, jukumu letu. Asanteni, can have a seat. And just after they have seated, I have the Nairobi, the 17 sub-county chairperson for Nairobi. Kindly, I know we do not have another time to discuss. Just kindly stand up wherever you are. Nairobi sub-county leaders, 17 sub-county. Yes, this one, as you can see from far, right is Abdi from Langata, the great Langata. We have James from Embakasi West, Ngugi, sorry. Hapo nyuma tuko na Juliana from Embakasi East, tuko na Benson Mwangi from Embakasi Central. Nyuma yake kuna Aisha Hamisi from Kamukunji. Anayemfuata kuna Alice Njeri from Starehe. We have Mose from Westlands. We have, excuse, Thomas kidogo. Thomas. So we have Enoch, a representative. We have Nyatuke from Dagoretti South and Kimathi from Dagoretti. We have Roysambu Nanzi Minayo from Roysambu. We have Karanja from the Great Makadara. We have Francis from Kibra. And then we have Benson Omai from Embakasi North. We have Francis from Embakasi South. Sorry, Omai for Westlands and from Embakasi North. Thank you. These are the delegation and the representative of the community workers in 17 sub-county of Nairobi. So we are well represented. First and foremost, I appreciate to take this role as the Nairobi community health workers. For those of us who have been interacted, I'm Ken Adagala, popularly known as Adagala. And the community health workers have been on the forefront. As we all know, it is the level 1 of this issue concerning the health. So Nairobi, we have over 7,320 community health workers who are serving 100 households per each community health workers. So you can do the calculation. Out of 320 community health workers times 100 households, that is the people we reach to in Nairobi. We appreciate the progress that you have made since the establishment of the community health workers. It started way back. It runs over 3 decades right now. But in 2010, it was introduced the issue of the community health strategy. And this one, as we all know, we were all in the dispensation of the Millennium Development Goal. And as we can know, even in the World Health Organization, community health work is a resource. And being a resource, it was one of the development goals that was anchored by that time. And they were adopted. And as we can know, SDG number 3 talks about health and well-being. So right now we are sitting here, we cannot be discussing about health and well-being when the community is not healthy. We must be in a position to understand the level 1, the household is equipped and is also in a position to provide the necessary essential services for the people of Kenya and for themselves. This one is also subdivided into community units. And these community units are the one that makes up 7,320. We have 732 units in Nairobi. And that units comes as a result of the community health strategy that was established in 2009-2010. Most people were trained. Some of them are still alive. Some of them have left. And that is so unfortunate. Under Millennium Development, under the Sustainable Development Goal, we are able and looking forward through the establishment of the government priorities like the Vision 2030, as well as the universal health coverage. We shall all strive to make sure that we advance and make sure the issues that have been addressed either in the Vision 2030 and the universal health coverage as attained as per the matters concerning the people's health. In the community health services, we are glad that it was just an amorphous, but through the leadership of these people that have stood here and the organizations that have had right from the grassroots, we have been able to come up and to make sure that the government of Kenya recognizes that we have community health workers, even though we are called volunteers. And last year, we launched the Community Health Act, Nairobi County. So this tool, I know it has not yet started to be implemented, but after or just being one of the achievements that you have made, the Nairobi City County Community Health Service Act 2019 is giving a roadmap towards making sure that community health workers are paid, are not only volunteers. And even if we are volunteers, even the United Nations have volunteers, but they're being paid and they are driving big. Even Amnesty has volunteers. Even any other state organs have volunteers, but they are being paid. But when it comes to community health, there's no payment. So the roadmap that you have created, the achievement that you have made through the Act will make us as community health workers and the communities that we are serving for benefit from the services that we are providing to this nation. We also have other bills that are being passed, are being implemented or talked about in Parliament and Senate, which are going to nationalize the Community Health Workers Task Force or the Community Health Workers Force. And to this note, we understand, if you are here and you come from different parts of Kenya, just reach out to the community health workers there and let's start organizing so that we can be well articulate the matters of the People's Health Manifesto. We understand we have a role to play, and it is very important that we work together so that we achieve this vision. Apart from the said progress, we also have the issue of the challenges, and the challenges comes in because it is man-made. If what we are advocating for will have to be improved, then through the Act, the challenges will be solved. One of them being no payment, lack of materials for reporting or the reporting tools, as well as no welfare. Most of community health workers have died, and if they die, we contribute, and if we do, there's no any other support that we get. So we need a welfare. We don't have one, but through the Act, through the Nairobi Community Health Workers Association, we are now working towards making a welfare, an organized welfare that will unite all of us, form a union that will also advocate for our rights. Lastly but not least, I'll take this opportunity to thank each and everyone who has come to this occasion, understanding very well that as the people of Kenya, the issue of health is part of our constitutional right. Under Article 43 of the Constitution of Kenya, we understand one of the aspects on the social amenities is about health, is about housing, is about affordable education and what have you. So as per we advocate for the issue of health, it is not a favor, it is a right, and being it is a right, we should work towards achieving that goal and make sure as a people we understand and we take care of the same. So to this end, to the community where we come from and to the people that we represent, the People's Health Manifesto will guide and serve as a document that will not only see the people of Kenya going forward in terms of health matters, but also advocating for other issues that we understand as a community is very important. Health is wealth. Asanteni.
Before you sit down, afya yangu? Si umesema jukumu langu, si ulikuwa umesema yako? Oh, afya yako? Afya yangu? Afya letu? Thank you. All right, thank you very much.